As you know that we are just nearing to our 1,300 day by just 4 days, and we have we have an excellent guest today from Dr. Sahani's family, and he is the third generation homeopathic doctor and doing wonderful job in teaching as well as in practice. So let me introduce Dr. Amit Sahani, MD. He has completed his MD and later completed PhD in homeopathy. And this is something great. These nowadays, our homeopathic doctors are getting these PhDs and becoming more and more efficient personalities in this field of homeopathy, and that will be a big boost for homeopathy all in all. And he is a person who has made a wonderful job in promoting homeopathy by writing articles in various papers, journals, as well as art periodicals, and he is presently working as as the professor, Department of Repertory, RBTS, Government Homeopathic Medical College, Muzaffarpur, Bihar, and he has completed his BHMS from prestigious National Institute of Homeopathy and PG from GD Medical College, Bhubaneswar. And he is associated with many organizations, particularly HMAI, LMHI, and he is presently the member as well as the secretary of the HMAI Bihar group, and he is the member of Indian Science Congress Society as well as uh, he is associated with the Rotary International as well and YMCA. Dr. Amit also sought resource person for seminars by reputed organizations like Bihar State Health Society, Bihar Voluntary Health Society, and so many. He has published so many books in homeopathy. He has done so many research work in homeopathy, and he is also working as a guide, and he has won many awards, organization award during the type year cancer from Cancer Institute of Homeopathy, National Seminar on Cancer and Homeopathy at Darjeeling, Best Teacher Award in 2019, and so many awards. So I'm not going to elaborate. All those things are there in the poster we published yesterday. And today, Doctor will be discussing one of the best subject of the day. As you all know that this subject is very, very relevant nowadays because the concept in fever homeopathic perspective. As you all know that each and every homeopathic doctor gets fame by treating acute illness. When you treat an acute illness and the patient gets cured in the shortest possible time, then definitely that person will become a winner and will become more reputed among the public. So let us invite our beloved guest, Dr. Amit Sahani, to the stage. You are proudly welcome, sir.
Thank you, Dr. Dhanesh. Thank you.
Sir,
This IFPH.
sir, please adjust your camera a little more. Only, yes, yes, little. Oh, okay, and little more. You can just okay. Now it is fine. Okay, begin, sir.
Thank you, sir. Thank you so much, and thank you this IFPH platform for giving me this opportunity again and again for presenting my seminars. So today, sir, I am talking on the concepts of the fever and how we can manage the fevers through homeopathy. So let me first start sharing my screen. So I hope the screen is visible to all of you.
Yes, yes.
Yes. So it is about the concepts in fever, and we'll see the homeopathic perspective of the fevers, and have an understanding of how we can approach with the cases of fevers. So fever, as we can say, it may be one of the ancient hallmark disease. Actually, it is not a disease. It dates as back as the civilization itself. Fever as being induced by the evil spirit. So this was one of the earlier concepts, that fever was responsible, was because of some of the sins, some of the ills that have been done by us. So the oldest civilizations, going back to the Egyptian civilization, the Mesopotamian, the Chinese, Indian, and the Greek civilizations, they have demonstrated extensive knowledge of anatomy and physiology, but they tended to view fever as something being induced by the evil spirit. So although there was although the civilizations kept on advancing, and we had ideas, we had knowledge about the anatomy and the physiology, but still this symptom of fever, it was regarded as something which was because of the done to us by the evil spirits. History reflects that fever was feared by the ordinary people as a manifestation of punishment. So and hence this concept that it is induced by evil spirit, or maybe it is a marker of death. However, the medical scholars, the biological role of fever in disease was considered as beneficial, particularly so among the Greek scholars. So this was one of the ancient concepts, that fever was also beneficial to our body. It was a positive indication. So there is a debate going on whether fever is altogether not important for us, is not beneficial for us, or it may be harmful for us. So this concept underwent a radical transformation in the 19th century, and scholars, they began to regard fever as harmful. So what initially was a concept among the Greek scholars, that fever was a good thing, was beneficial for the human being. Then this concept underwent a transformation in the 19th century, and it is being considered as harmful. So the use of antipyretics is now being considered beneficial. Now we believe that we should not allow the patient's temperature to rise beyond a certain degree, and we are trying to justify the use of the antipyretics. However, this introduction of the fever therapy, we have to go back to the 20th century and concept, and understand the concepts of in the changing patterns of the fever, the changing concepts that have evolved over the time. So coming to the current concept that spans over the past 40 to 50 years, intensive research has been carried out to investigate the role of fever. Although all they are not in the same agreement, there is some disagreement. Evidence now indicates that effects of fever are complex, but it is overall beneficial. So fever is considered as an indication. It is an indicator of something which is going on inside the body, and that is why it is considered an indicator and is considered to be beneficial. So like a lot of other symptoms, fever is also a symptom, and which may be accompanied by many other symptoms. So the concept that evolved in the 19th century was the part of the symptoms complex as it is today. And so fever is a part of the symptom complex. Fever by itself is not a disease. It is a part of the symptom complex. A disease in its own examples of fever being regarded as a disease, where autumnal fever, we have the terms like autumnal fever, jail fever, hospital fever. So there are different examples of fever, but by itself, it is just a part of the symptoms. It is just a symptom. Fever could also be described in terms of severity of the disease. For example, malignant fever, or maybe pestilential fever, or even supposed to be the fevers like bilious fever or nervous fever. So we have a lot of terminologies which define maybe the origin, maybe the severity. So, but still overall, we have to keep in mind that fever is just a part of the disease complex, just a part of the symptoms complex, not a disease in itself. Nowadays, antipyretics are amongst the most used drugs worldwide. We have seen a lot of use of these antipyretics in the COVID time also, and even post-COVID and even before COVID, this paracetamol and all those types of antipyretics, they are widely used. They have more or less become like a type of over-the-counter prescription, over-the-counter medications. So they are one of the most widely used drugs. And despite their widespread use and popularity, question arises as how beneficial the fever is, whether fever is important for us or whether the fever is harmful for us. So we have to critically analyze this thing. We have to critically analyze this thing and come to the conclusion. We have whether this thing is fever is beneficial to us or not. So one of the breakthrough in the fever concepts came with the science of bacteriology. It was able to reveal the etiology of many infectious disease. We know the causations of malaria, we know the causations of typhoid, we know the causations of this dengue. So we know a lot of the causative agents. So coming to the typhoid, which is caused by the bacterial agents, identification of the typhoid bacillus in 1880 and discovery of the tubercle bacillus in 1882. So they brought about a revolutionized approach and in understanding of the fevers. Fundamentals of thermoregulation and the role played by the exogenous and the endogenous pyrogens in the induction of fever. So we all know our body has got a thermoregulatory mechanism, and it tries to maintain an optimum temperature in the body. And so the body temperature is in healthy organisms, they are regulated by balancing of the heat production and loss. So we have a number of systems working together in a synchronized manner so that an optimum temperature is maintained. We have the sweating system, we have got the hypothalamus, which is regulating this thermoregulation. So it was demonstrated that animals, they died quickly when the body temperature exceeded the normal level by 5 to 6 degrees, which suggests that fever may be harmful and that antipyretics, which were introduced later, may actually be beneficial. So with this observation that once the temperature of any animal, it rises beyond a limit of maybe 5 to 6 degrees centigrade, the animal may die, which suggests we have to keep a watch on fever. We have to keep track on the fever, and if if necessary, we can control it by using antipyretics, which and this suggests that the role of the antipyretics may be actually beneficial, may actually be required. Now, William Osler, he declared that humanities had three enemies: fever, famine, and war. And he said, among all these three, fever was the greatest enemy. It killed a far larger population than the rest of the two. Fever is among the most common complaint and causes of seeking medical attention. So we see a lot of patients coming with different clinical conditions and at the same time complaining of fever. The biological value of fever, that is whether it is beneficial or harmful, is a matter. Dr. Dhanesh, should I continue?
Yes, sir. Yes, sir. Please continue,
okay.
Sir.
Okay. So I was talking of the biological value of fever. Now, irrespective of the fact that whether it is beneficial or harmful, it is which still remains a matter of dispute. The fever is being treated with the belief that it may prevent complications. So I had once talked of the hygiene theory. So as an on the patient, as an on we are becoming more hygiene conscious. The prevalence of the infectious disease, they are going down, and on the other hand, we see the more dreadful diseases like cancer, maybe the chronic diseases, they are becoming more and more. We are having a greater incidence of these type of diseases. So what was happening actually earlier was that people were getting infected with infectious disease, and which was preventing the incidence of the more graver diseases like cancer and other life-threatening diseases. So actually, fever may in this light can be considered to be something beneficial which may prevent complications. Fever is harmful and may bring about discomfort. So there are certain arguments which says ki fever may actually be harmful, and one of the argument is fever is harmful and it may bring about discomfort, dehydration, maybe febrile convulsions, brain damage, and ultimately death. So antipyretics, they are the preferred method of managing fever, and there has been an increase in the preference over the past 2 decades from 67% to more than 90%. So there has been a paradigm shift in the use of these antipyretic medicines for managing fever in a very great proportion from the past to the now. The risk of febrile seizure, uh, this is one of the things that maybe many pediatricians or the doctors, they say it is one of the major risks of fever. So fever, it is said they may cause some brief benign convulsions in maybe 3 to 4% of the children. In one of the studies from USA, 49% of the pediatricians considered convulsions to be the principal danger of fever, and 22% believe that brain damage could result from febrile convulsive seizures, and that antipyretic measures should be administered to prevent this febrile seizures and other complications of fever. So fearing febrile seizures is one of the main, I think, main reason for use of the antipyretics, so that fever can be controlled to prevent febrile seizure and maybe prevent this brain damage. So considering febrile seizure to be one of the bad effects or complications of fever, it was considered to manage fever using antipyretics so that the febrile seizures could be prevented, the brain damage could be prevented. So these were the arguments that fever was harmful and that thus it needed to be controlled by antipyretics. There are some arguments on the other hand which says ki fever may at the same time be beneficial. So fever is self-limiting and well controlled. With fever, unlike hyperthermia, body temperature is well regulated by a hypothalamic set point that balances heat production and loss so effectively that temperature will not climb up relentlessly and does not exceed an upper limit of 42 degrees centigrade. Within this upper range of 40 to 42 degrees centigrade, fever is not injurious to the tissue. So fever is something which is different from hyperthermia. Hai. So this argument says that fever is something which is different from hyperthermia, and this body temperature, it can be regulated, and having fever in the range of say something 40 to 42 degrees centigrade is not injurious to the tissue, and it is in fact beneficial for the person who is suffering from fever. Second argument is this: antipyretics, they will not prevent febrile seizure. There is now evidence, a lot of evidence against the previously assumed risk of febrile seizure. Previously, it was a dreaded thing. Having febrile seizure, it was considered that the brain of the child will become damaged. It is also known that antipyretics are ineffective in prevention of the febrile seizures. So giving antipyretics will just lower down the temperature, but in under circumstances will prevent the febrile seizures. The effects of fever on microorganisms. Animal studies have demonstrated that gram-negative bacteria, such as Salmonella typhi, were shown to be increasingly susceptible to antibacterial effects of the serum when cultivated at a temperature greater than 37 degrees centigrade. Fever has therefore a favorable prognostic influence on the length of the bacterial excretion. So at a higher temperature, it is supposed that the bacterial activity, it will be limited. Thus, it may be beneficial for controlling the fever in the long term. Some more arguments which are still in favor of fever being beneficial. So effects of elevated temperature on the defense mechanism. Fever may act synergistically with antibiotics. Penicillin was found to have a progressive increase of its bactericidal activity as the temperature rose from 35 to 41.5 degrees centigrade. So penicillin was found to be more effective in its bacteria killing property when the temperature of the patient increased from 35 to 41.5 degrees centigrade, something like this. So fever was in fact beneficial for providing a better environment for this penicillin to act. And lastly, the hygiene theory that I had talked of. The prevalence of the asthma and allergic disease as well as cancer has increased worldwide. We have increased incidence of asthma. We have increased incidence of allergic disease. We have increased incidence of cancer. And what, on the other hand, we are seeing a decline in the incidence of the infectious disease. Now, which can be attributed to this hygiene theory. So as and on, we are progressing with, we are becoming more hygiene conscious. The infections are being controlled, but on the other hand, the incidence of the chronic disease, asthma, allergic disease, the cancer, they are on the increase. So as long as the patient, as long as the human race, it was more affected with the infectious disease, and as a result suffered from fever, now has to bear the brunt of more uh, uh, deadly diseases like asthma and cancer. So actually, fever was beneficial. Over the past 40 to 50 years, coming to the current scenario, intensive research has been carried out to investigate the role of fever. There is evidence now that indicates that the effects of fever are complex but overall beneficial. Accumulated data from the extensive research suggests that fever has a protective role in promoting host defense against infection rather than being a passive byproduct. There is also evidence that fever exerts an overall adverse effect on the growth of the bacteria and some tumors, as well as on the replication of the viruses. So fever, maybe the incidence of the fever, the increase of the temperature has a control mechanism over the growth of the bacteria and the viruses, and it limits the activity, and maybe a curative action is being taken over by the body by increasing the temperature. It also enhances the immunological process, although scientific evidence does not support this practice. So it is also believed that the fever, it enhances the immunological process of the body and helping our defense mechanism to fight against the external morbific agents. Coming to the homeopathic concept, aphorism 239 of Organon of Medicine, it says, he has almost every medicine causes in its pure action a special peculiar fever and even a kind of intermittent fever with its alternating state, different from all other fevers that are caused by other medicines. Homeopathic remedies may be found to be may be found in the extensive domain of the medicine for all the numerous varieties of the natural intermittent fevers, and for a great many of such fevers, even in moderate collections of the medicines already proved on the healthy individuals. So Dr. Hahnemann, in his Organon of Medicine, he has already said that every medicine in our Materia Medica, it has got its special kind of fever. Now, while he is describing this intermittent fever in this Organon, he says, as many medicines we know, we have got as many as we have got a curative remedy for those type of fever. So every remedy has its peculiar fever, and all the fevers that have come upon human race and will come upon human race will have a solution among our homeopathic medicines, because it is based on the symptoms. It is based on the totality of the symptoms presented by the fever. The homeopathic perspective of fever is following the guidelines as presented in the Organon of Medicines and regarding the case taking from aphorism which has been discussed in the Organon in between aphorisms 83 to 104. So 83 to 104, it says that every case must be individualized, we must try to individualize the case, we must try to define the symptoms of the case so that we can come out with the peculiarities of the case, and those peculiarities, they will suggest a proper medicine. Specific guidelines for case taking of the acute disease, they have been given. It is said that the case taking of the acute disease, they are comparatively easy. Now, it has been said so because Organon says when the person is suffering from acute diseases, all the changes, they are very fresh in the memory of the patient. They are very fresh in the memory of the patient, and the patient will be able to recall all the changes that had happened over the stages, that had happened over the stages, and will be able to recall and reproduce it in front of his physician, so that it can be used as one of the symptoms for prescribing, finding out the most exact simillimum for the patient. And understanding of the fever is described in the intermittent fever section of Organon of Medicine in between aphorism number 231 to 250. So these are the places where we have to develop an understanding of how we can deal with acute disease, and especially acute diseases like fever. Now, regarding the fevers during the pandemic and the epidemic, after seeing a few patients, a genus epidemicus understanding comes. Aphorism 100 says कि we have to develop, we cannot regard any disease as we know it by its name. Although we may have treated the patient of that epidemic, but we cannot still regard the such diseases to be already known to us, because each epidemic is very fresh, has got a very fresh presentation of symptoms, a very fresh collection of symptoms. So a number of cases must be examined from the present epidemic. A number of cases must be examined from the present epidemic. I am quoting aphorism number 101. It says ki a number of cases must be examined, and that will bring out the symptoms from the case, the common symptoms of that epidemic. The common symptoms will become more characteristic as we see more and more cases, and finally it will help us to suggest a genus epidemicus. It also brings our attention to particular group of medicines which are indicated frequently. So a group of symptoms which is common to that epidemic will point out to certain group of medicines which are more peculiar to that group of symptoms. Yet, as every individual are unique and should be kept, and we should keep ourselves vigilant for the search of individual medicines beside the genus epidemicus. So our target should be to define the patient more in his peculiarities, more finer definition of the patient should come out through every case taking, so that we can find out a medicine for that individual rather than rely on prescribing him the genus epidemicus. So we have to keep in mind that individuality is the ultimate guide for that singular characteristic medicines, and we are a system of medicine which is based on the peculiarity of that individual. We have to rely on the individuality. So the overall view of Dr. Hahnemann was that the totality of the symptoms which characterizes a given case, being once committed to writing the most difficult task, is accomplished. So it is said, a well taken case is half cured. Now, so once you have recorded the case, once you have taken the case of a patient, so you have come out with the most characteristic symptoms. You have brought down in writing, and that the most difficult task is completed, because we have the symptoms in our hand, the characteristic symptoms in our hand, important symptoms which may be pointing towards our medicine, toward a medicine. So collectively, this grand totality should point out to a medicine which is most appropriate for the patient, most simillimum to the patient. Coming to some stalwarts remark over the understanding of fever, over the management of the fever. So Dunham says to select a remedy after a masterly examination and record of the case is comparatively easy. So to select a remedy after we have collected a thorough case taking, and then to find out a medicine, it is quite easy. But to take the case require great knowledge of the human nature and history of the disease. So if we want to record a case, if we want to take an appropriate case taking, it is said that we have to have a knowledge of the human tacts, human understanding, because we are not dealing with machines. We are dealing with humans who are so much varied in nature. We are dealing with humans who may be most sympathetic to the most cruel ones. So we have to have an understanding of the human tact, of the knowledge of the tacts. We have to have a tactful understanding of the human psychology, so that we can handle each patient individually and come out with informations. The main objective is to come out with meaningful informations that will be helpful for us in selecting the medicine. So he says, go very slowly. The disease demands a closer observation of the instructions. So we have to examine the patient very closely. We have to keep our observations very sharp so that we are not going to miss out anything. And strict adherence of the principle is necessary for successful treatment. So we have to be strictly rely on the principle of similimum, principle of similarity of symptoms, so that we can find out an appropriate medicine for that patient. So this is what Dunham says regarding the management of the fever. Understanding of the fever from the Bonninghausen therapeutic pocketbook. There is a separate section for the fever, which has got 7 subsections. The 7 subsections which have not been described in alphabetical order in the Bonninghausen therapeutic pocketbook. It is circulation of blood, cold stage, coldness, heat, perspiration, compound fever, and concomitant complaints. So these are the 7 subsections in the fever chapter of Bonninghausen therapeutic pocketbook. And this is one place where we see how we can find out the meaningful symptoms of the fever, especially the compound fever, which has got a lot of permutation and combinations of the different characteristics of the fever, different stages of the fever, so that none of the permutation or combinations is missing out. Coming to the Bonninghausen characteristic, Boger's characteristic repertory, Boger Bonninghausen characteristic and repertory, the fever chapter by itself, it is most exhaustive. I have gone through a number of presentations where this fever chapter of this Boger Bonninghausen characteristic repertory, it is compared with the W. A. Allen fever repertory, H.C. Allen therapeutics of intermittent fever. And still the Boger Bonninghausen characteristic repertory seems to be more exhaustive than the individual literatures of W. A. Allen and H.C. Allen. The arrangement of the chapter on the fever itself is self-explanatory. For the practical point of view, this chapter is of immense use. It has many sub-rubrics, concomitants in relation to chill, heat, sweat, beginning with chill, beginning with sweat, beginning with heat. And so we have got a number of permutations and combinations in this fever chapter, so that none of the stages that we can imagine can be missed out. And in fact, it has been very beneficial in the recent epidemics and cases of fever. So to frame the fever totality using the Boger's concept or using the Bonninghausen's concept, and with the help of this BBCR repertory, the arrangement of the chapter on fever, it has got, this chapter is of immense use. It has got many sub-rubrics. Each stage is followed by time, aggravations, ameliorations, and concomitant. So every stage of fever, heat stage, the time, the aggravation, the amelioration, concomitant, they help to repertorize any simple as well as complicated cases of fever. They should be arranged properly in order to get the similimum with the help of Boger's repertory. So we have to analyze the symptoms, we have to evaluate the symptoms meaningfully, keeping the Boger's philosophy, the Bonninghausen's philosophy in mind, the concept of grand generalizations in mind, so that we can come up with meaningful result using this BBCR repertory. The different chapters and their sub chapters when described in the BBCR repertory. So we have got fever, chill, generals, and compound fever. This is follow the symptoms of pathological types: blood circulation, congestion, palpitations, pulse, signs in the fever subsection.
Sorry, I don't know where that is.
Chill is followed by partial chill, coldness, partial coldness, shivering, time, aggravation, amelioration. And every section concomitant is found observed.
Hello, sir. Hello, sir. Yes. I think there was some network problem with the Dr. Amit. As now, sir has rejoined. Again, the fever session was going in a brilliant way. There was some technical problem with the Dr. Amit. I hope sir will be joining shortly. Please write. Yes,
Yes.
it is coming.
Yes, I was talking of the
Yes, yes.
different sub chapters in the Boger Bonninghausen characteristic and repertory. So they have got five chapters under the fever, related to fever, and there is concomitant which is observed in all the chapters. At the end of each chapter, we will have concomitant sections which is related to the fever. Now coming to the Kent's understanding of fever, or the arrangement of the rubrics related to the fever in the Kent's repertory. The chapter fever from the homeopathic repertory by Dr. James Tyler Kent. This repertory was originally published in 1897. This chapter gives all the symptoms related to the fever in alphabetical order, along with the indicated remedies. Chapter chill. There is a separate chapter chill in the repertory, and it has got all the rubrics which are related to chill in alphabetical order. There is a dedicated chapter for fever. The fever related to the rubrics are also found in all the chapters, including the mind section. And we have got rubrics like dullness during heat, active during heat. And so a lot of rubrics related to fever are also there in the mind chapter also. And some general chapters like stomach. We have got thirstless during fever, thirst with fever, and dullness during heat. So we have got a number of symptoms which are related to fever in other chapters also. So apart from having a dedicated chapter to fever, a dedicated chapter for chill in the Kent's repertory, there are some examples of the rubrics which are present in the fever chapter in the Kent's repertory on my right hand side. Now coming to the concept of online case taking for fever. Now, so we have got a lot of patients who ask prescription for us over the phone or maybe online. So we have to keep a key of important things, that we can gather more and more informations, more appropriate informations, which will be meaningful to us for finding out the medicines. So one of the difficult thing that one of the difficulties of online case taking is developing that doctor patient relationship, because we know key informations are meaningful to us. We are helpless without informations, and whether the patient is going to disclose the information to us, whether that initial rapport has been established or not, is very important. So we must try to prepare the patient for the initial consultation, so that a healthy doctor patient relationship is established, and we come up with some meaningful informations from the patient. We have some defined symptoms from the patient, symptoms which are meaningful, so that we can find out an appropriate medicine for the patient. And then of course we have to go on with our normal process of case taking and coming out with the appropriate medicine. Now, history taking in a febrile patient. So what is difficult here is using the Hahnemann's directive as a framework to interviewing the patient. So we have to keep in mind that we know nothing of the patient. We have to approach the patient with an unprejudiced manner, And the most important step is taking a meticulous, detailed history to explore the patient's problem from three perspectives: from the biomedical perspective, from the contextual history, and from the patient's perspective. And then finally, we have to have a systematic review. So the biomedical perspective is to understand the chronology of the symptoms, analyze each symptoms, and review each system to localize the source of the fever. So this is the biomedical perspective that we have to go as per the symptoms, its chronology, and try to find out what exactly the source is. Then coming to the contextual history of the fever and the patient's perspective, we must try to understand the patient's interpretation of his illness. Now, what he thinks, why he has become ill, and then the system review. This is a guide not to miss anything, any significant finding. So we moved to, and depending upon whether you think where it belongs. So biomedical perspective. So we have to give importance to the presenting complaints, whether the patient is feeling hot. A feeling of heat does not necessarily imply fever. There may be hot flushes, but still no fever. Rigors. There may be profound chill accompanied with chattering of the teeth and severe shivering, and it implies a rapid rise of the body temperature. It may be caused by, and the presence of rigor, it may indicate diseases like brucellosis, maybe malaria, maybe sepsis, maybe lymphoma, and it will be accompanied by excessive sweating. Night sweats are characteristic of tuberculosis, but sweating from any cause is usually worse at night. So this biomedical understanding of these complaints, they give us an idea what may be the underlying cause, of the fever. Recurrent fever, the source is often a focus of the bacterial infections such as cholecystitis or cholangitis or UTI, especially associated with an obstruction or calculi. Headache, delirium, muscle pain, they all have to be analyzed. What may be the how it may be related to the fever and how it helps us to find something important, give us some important informations regarding the fever. So the presence of the fever, the duration, the mode of onset, the progression, the severity, the treatment it has received, and the associated symptoms. These are very important. The associated symptoms, they help us to find out important medicines. The biomedical perspective also help us to understand the patient from the systemic examinations, the respiratory tract symptoms, abdominal symptoms, the skin rash, and we have to go system wise so that we can come up with some meaningful informations. Coming to the contextual history, the past history, the surgical history, history of any blood transfusion, history of any disease in the past, maybe some chronic diseases like rheumatic heart disease, which may develop into infective endocarditis or some other disease, a history of trauma. So all this may be the contextual history which may be responsible for the present condition of fever. We may have the patient may have a history of drug or allergy and over-the-counter medications, vitamins, maybe traditional medicines, herbal medicines, blood transfusion, immunizations. So all these may contribute to the fever. The family history, any familial disease that may be running in the family, infections that may be running in the family, cholera, typhoid in cases of epidemic. So we have to have an understanding of the contextual understanding of the patient. So all these the history, the personal history, smoking, alcohol, educational background, home environment, sexual history, the uses of drugs, sharing of needles, all these we have to understand so that we can have an understanding how, what, and why, what, and how of the fever. So travel history, where the patient stayed, how long, whether he had taken prophylaxis, whether he had taken proper protections against the maybe mosquitoes and other infective agents that may be prevalent over there. Coming to the patient's perspective, we should always ask the patient what he thinks about his disease by analyzing the ideas, maybe the concerns, the feelings, expectations, and effects on daily living. So what is the patient's idea about his own disease? And then the systemic review. So the totality of the fever is scattered. Concentrating only on the fever will not bring any desired results. So if we focus only on the symptoms of the fever, we may not come to a proper understanding. So it has always been the man in disease, not the disease in man. We have to give importance to the general symptoms which are associated with fever. The symptoms associated has to be understood with its causation, expression, and finally the effects. So we have to give importance to this flow chart so that an understanding of the symptoms, the evolution of the symptoms can be understood in a proper light, and there will be some meaningful informations which will be pointing towards a similimum. So similimum comes from comparison. Dunham says that selection of the remedy for a case of sickness is a process of comparison. We seek parallelism between the drug symptoms and those of the patient. So opposing the disease state. So it has been a tendency for the rebellious modalities or the rebellious symptoms. During fever, two opposite behaviors may be observed. It is the nature of the individual to oppose anything that come as a hindrance in his normal and matter of ease. So we may have symptoms where one part of the body is better by cold and other part of the body is better by heat. So we may have rebellious symptoms in the same patient. So we have they are very important for us for finding out the medicine. Now just let me end up with at least one or two cases of fever from my clinic. So this is a 40-year-old male patient. And he was already in consultation in our clinic with complaints of hypertension, and he had suffered from fever in the month of July and was found in the year 2020, and he was reported to be COVID positive. He was very panicked, and after he was detected positive, but he still had confidence in homeopathy and wanted to take treatment from us. So what we observed in the case was there was a feeling of heaviness in the chest. The throat was painful, burning ever since fever. The eye was also burning. He was feeling weak. He was under our treatment for chronic illness earlier. He was suffering from hypertension. His constitution was lean and thin. Anticipatory fear dominated all the time. And presently the mind was revolving around the disease. You can say the mind was occupied with the disease. So we had taken these following rubrics for that patient: chest operation fever during, throat pain during heat, eye pain during fever, weakness fever during, general complaints chronic, ailments from anticipation, thoughts disease of, and general lean people. So the repertorial totality, it was in favor of arsenic, sulfur, and sepia. So we didn't had a clear-cut picture, but overall, what you can see is already there in the repertory sheet that is present in front of you. Now we started the prescription with sulfur, and he was transmitted this medicine in 0/5 potency because we made it a habit in the COVID time to go with the higher potencies for the cases of fever. And this patient, he reported after a few stroke of the medicine that we do with our transmission set when we are administering the medicine using the transmission of homeo drug energy from a distance. So the methodology was applied, and the patient reported changes in the symptoms after some stroke was given to that vial of medicine. He reported that heaviness of the chest was better, then the fever came down, and then the fever limited, and then finally the patient was cured. So the case was treated with transmission of a single medicine, and that was sulfur in the 0/5 potency. So again, the patient COVID-19 test positive. It was again after few times the report it was again positive. The fever was there, and then we had to go for a change of the medicine, and we transmitted nux vomica, and COVID after 3-4 days, the report again came negative, and but there was some eruptions. No fever was there, and the patient was free from the fever of the COVID-19. Some eruption persisted, and he continued his treatment for the hypertension that he was earlier with us. So that was one case. I think I can go for one more case before.
Yes,
yes. So this is again a case of 36-year-old male, and again a case of COVID-19. So this patient, he was already under treatment for stricture of the urethra and was receiving constitutional treatment, and the last medicine that he was prescribed was cifilinum, and he developed fever on 12th of September 2020, and as per the symptoms of the COVID that happened during that time, the mouth taste became insipid. He was not able to perceive any taste. He became panicky with the fever in the present situation because he was aware of that what the loss of taste meant, and he went for the test, and that came out to be COVID positive. He developed cough along with the fever. Throat was burning, eye was burning. He was feeling weak. He was already under treatment for stricture of the urethra. He was feeling cold, and there was thirst for small quantities of water. And presently, the mind was worried whether he will survive or not. He was worried about his life. So this was the repertorial analysis. We took the following rubrics: mouth taste insipid, food tastes, stomach thirst small quantities of for fever during, fever accompanied with coryza, fever with chill, throat pain burning, mind anxiety, health about one's own, and mind restlessness, heat during. So the state of the mind during the fever was also given importance, and the repertorial analysis was in favor of arsenic. So that was one of the popular medicines that was for the COVID-19. So the first, as I said, we go for higher potency. So we transmitted this arsenic album in 0/5 potency, and the patient was asked to report after 2 days. So there was no change, but we still didn't do any change in the medicine. The patient ultimately became free from the fever, and after this he again reported for his chronic illness that was of the stricture of the urethra. Okay, so that was about the case that was cured by a single dose of arsenic album. Now I have another case. This again of COVID-19. He suffered from he suffered from fever on 25th of July 2020 and reported to be having fevers of 99 °F. We didn't change the earlier medicine. We just gave, he was on nux vomica 0/3. We just gave this strokes to this nux vomica vial, and she reported no change in the fever, and again stroke was given. By evening, we got the report that fever was maintaining a higher trend and had gone up to 102 °F. So we reviewed the present situation. We found that the mouth was dry with small thirst for small quantity. Eye was burning. She was feeling weak. She was under our treatment for some chronic conditions. Her constitution was lean and thin, and there was anticipatory fear which was dominating, and presently the mind was revolving around the disease state. So we made a repertorial analysis. The rubrics that were taken was mouth dryness during fever, mouth dryness, thirst with, restlessness, heat during, eye pain, fever during, eye pain, burning, general lean pupil, mind anticipation, and thirst for small quantities during fever. The repertorial result was in favor of lycopodium, arsenic, and veratrum album. So we started with Nux vomica, since he was already under treatment for Nux vomica, but in spite of giving stroke to the same medicine, there was no change in the fever. So we went on to arsenicum album. Now, since there was a rising trend, the fever had reached 102°F. We transmitted arsenicum album. Fever, there was no change, but the other complaints, she said she was feeling better. So we didn't go with any change of the medicine. We didn't give any stroke. We waited. So a little later, a few days later, she had chest pain and cough, which was aggravated in the morning. We gave strokes. So after 6 days, she had hard stool with pain in the rectum and the back. Again, we gave strokes. So after 2 days, there was no fever. And by 28th, the stool was also better. So within this span of time, she became free from fever, and we continued with her treatment for her chronic illness. So I think I should stop, Dr. Dhanesh, because
Yes. It is the time for discussion. Only few minutes remaining.
yes. So
Of course, we can have one more day with the case presentation of acute diseases, because that is a very good thing as far as our junior doctors as well as seniors are concerned.
yes. Do we have any question?
Yes.
Yes. Here somebody has asked, hair was used for transmission. Yes, Dr. Adil, we had used hair for transmission.
Yes. Definitely a very good session. Particularly acute management of fever is something great, because most of the people get it. But if we used to say that each and homeopathy is just like mathematics. You can minus the common symptoms of the patients and then observe what is rare in the patient. This is what each and every homeopath can do in a busy day. But the other side is the scientific method that has narrated by Dr. Amit here, showing some of the beauty of his successful cases, and that too with the LM potency, and that is very, very minimum dose. Frankly, we can subside, we can, there is no need of fear. If the patient is coming with you with a high temperature, it doesn't matter what. As a homeopath, you have to observe whether the temperature is on the head, or whether it is on the feet, or in the abdomen, or in the back. This is one of the things. You have to use your hand and to know whether the temperature. This is you have to use your hand to know the where the temperature is it. For example, if you get a patient coming into the if a child is brought to your clinic with the temperature, high fever, he is telling that, doctor, this child was playing so much in the day, but suddenly he get tired, and he is having fever, and he just like a log. He is lying like a log. Then you can think of belladonna. This is that is the short way of approaching our system. That itself, the patient's mouth, its symptoms itself reveals what it is, and then you observe what with your hand, that you can use both of your hands. You just put a hand on the forehead of the patient, and just put on the other hand on the feet of the patient. You can see the difference of temperature. Sometimes the temperature is same up and down, but in those cases you can take the temperature in general. But the other side, the other symptoms also may be different. So in all those cases, the medicine will be different. What's your opinion on that, Dr. Amit?
Sir, definitely fever, we have to give more importance to the modalities and the other finer symptoms, so that we can have a better understanding of the fever and the stages of the pyrexia, the different stages of the pyrexia. So definitely you have to have a very clear-cut understanding of the patient.
Yes, Dr. Usman, do you have to do you want to say anything on this session, or do you want to have a chat with Dr. Amit, and then you can say what of thanks to the session also, because time is just past
Thank
9.
you. Thank you, Dr. Dhanesh. Thank you, Dr. Amit. What a wonderful session. Fever is a very broad topic. You have tried to cover it in one our most of the aspects, how to take a case, what to do and what not to do. We would like to see you with more sessions and with further of your cases, that how you treat them, and if you spend more time on telling people that what to take, especially with when the patient came to the clinic, modalities and other aspects of the symptoms. So that would be nice if you come in future of your sessions with more of your cases. So that was a wonderful session today. Thank you, Dr. Amit.
Thank you, sir. Thank you.
Tomorrow we will have a session from Dr. Manish, and we are very thankful to those who participated in the session and those who communicated with the Dr. Amit. And anyway, we need some more presentation on the same subject. Hope Dr. Amit can come up with some cases from his kitty in the next presentation, so that each and everyone can understand how to analyze each and every symptom, even in case of a simple fever. This is a must, because this is the area which really bring homeopathy to the limelight and to the public, that we can do or whatever comes on our way with our tools. That is homeopathic medicine, single remedy. Thank you all, and thank you, Dr. AMIT SAHANI, for your excellent presentation in this evening, sharing your knowledge with our guests. Thank you all. Do you want to say anything?